everyone, my name is Grace and I'm here to talk about nursing. And where do I begin? It's such a huge topic to cover. But I think my first thing that I want to address is how nursing has totally changed my life on how I think, how I feel, how I react, how I do everything in my life. It's amazing how nursing can change your life based on the experiences that you have with your patients and with your multidisciplinary team. Anyways, my journey started about 7 years ago when I first decided that I needed to do nursing. I've been a nurse for 2 years and I currently work on a step-down telemetry unit. 7 years ago, I decided that when I wanted to go into nursing, I had to take all these classes. Well, they were all science classes, and I just absolutely suck at anything science. And then to know that I had to take organic chemistry, microbiology, anatomy and physiology, and all these science classes, I was just like, oh my god, not gonna do well. And then when I looked into it, it was like so competitive. You had to pretty much get straight A's to get into a nursing school. Well, I figured, well, this is what I was determined to do, so I gave it my all, and of course I made it into nursing school. I got into a Bachelor's of Science program, and getting a job was really, really hard, but I also worked as a CNA at the hospital I currently am at now, so don't let anybody discourage you in saying, oh, why should you go work as a CNA if you're a nurse trying to get a job as a nurse? Well, we all know that the job market is not good for nursing right now. And you need to get your foot in the door however you can. And honestly, being a CNA taught me so much about nursing. And I couldn't be as effective as I am now without having those lessons learned as a CNA. Having that said, I was a CNA for 8 months. The whole time I actually got a job at a SNF, and for those of you who don't know what a SNF is, it's a skilled nursing facility that my friend worked at, and I took care of 30 plus patients on a daily basis. And that was hard, but, you know, most of the patients there were stable, so everything had an organized chaos to it. And so I worked 2 jobs at a time. It was quite exhausting. And finally, the unit I worked on decided to have a new grad program. And of course, being that I've been on the unit and worked really hard, and they hired me. And I've been there since, and it's been one of the most challenging things I've had to do, but I absolutely love. I am completely exhausted. I have very little social life, but you know, the reward that you get from working on a unit like the one I work on, it's just amazing. There's so much to learn, and there's so much patient interaction and family and doctors and multidisciplinary teams that, you know, I wouldn't trade it for anything. In my following videos, I will talk more about any type of questions that you have. Just leave them down at the comment box below. And occasionally I'll have some of my other nursing friends come on and we'll help demonstrate some simple stuff for new nurses, like IV starts and dressing changes. And for some more advanced nurses, I'll have like more critical care nurses who've been in the industry for 5+ years, and we'll talk about some ACLS real life situations with code blues and such. So I hope you guys keep tuning in, and don't forget to subscribe. Thank you so much. I'll talk to you later. Bye-bye.